alone. That is nearly twice the average for the preceding 35 years, according to NOAA. And that was only until Irma became the 11th billion-dollar event, heralding an era of superstorms, delivering more rain, higher winds, greater storm surges, and rising seas. As climate change makes our planet sick, so will a sick planet erode the health of its people. There are no emergency rooms for planets. We have to have preventative care programs that are put in place so that these events that occur because of climate stop sending people to emergency rooms with the public health consequences of not dealing with a preventative care program for the planet. Hacking cough, global warming makes air pollution worse, harming our lungs. Sneezing and sniffling, climate change supercharges allergy seasons, not just storms. Heat stroke, a warmer future, will lead to more heat-related deaths and diseases. And the higher the level of carbon dioxide, the more nutrition is drained out of grains, like wheat, not to mention behavioral and mental health impacts due to displacement, death, and injury from tragic and extreme weather events. And increased infrastructure costs for maintaining wastewater and drinking water treatment plants. Climate change impacts the geographical area of diseases from mosquitoes and rodents. We've seen it with Zika, with Lyme disease, dengue fever, West Nile virus, and we're seeing today the Army spray down in southern Texas because of their concern after the storm of a rise in Zika and West Nile disease, amongst others, directly related to the storm which just passed through. And the more we learn about the impacts, the greater the challenges that we are going to face. That's why Congressman Cartwright, who will be here in a couple of minutes, and I are introducing legislation in the Senate and the House, the Climate Change and Health Protection and Promotion Act. This bill mandates the development of a national strategy to identify, prepare for, and address the health impacts of global warming. We're seeing it on television every single night. The need to have preparation, the need to have the resources to deal with the consequences of these weather events. It doesn't just lead to additional diseases, it could also lead to death. It will help us to create a health ecosystem that recognizes and can respond to the climate impacts on health. It places a special emphasis on identifying communities that often bear the brunt of climate impacts, the poor, the sick, the elderly. The bill encourages research and collaboration that will help us improve our public health knowledge and response strategies to climate change. If we are going to save the Earth from global warming, we all need to be the doctors and the nurses and the scientists who create and deliver the cures that will cut the pollution that is killing our stable climate at an ever-quickening pace. And if we are going to save each other from the serious public health impacts from climate change, we all need to take responsibility and to create a treatment plan for the coughs, the congestion, and the deadly diseases that will result from a more polluted world. The prescription for what ails us is clear. We need to deploy the clean energy and energy efficiency solutions that will reduce the carbon pollution and begin taking steps to address the effects of a warming planet that we can no longer avoid. Unfortunately, climate change is a lot like Donald Trump. When you ignore it, it only gets worse. We are seeing that in the White House. We are seeing that in the storms, the supercharged storms that are being created on a more regular basis on our planet. So I thank you all for being here. at this time, and Congressman Cartwright is right now casting a vote over on the floor of the United States House of Representatives. So let me begin by introducing Dr. George Benjamin. Thank you.
Well, let me just take a moment to just thank Senator Markey and Representative Cartwright for introducing this bill. I was a state health official on 9/11, and you know, we have spent the last 16 years building a preparedness system to address the tragedies we've seen over the last couple of weeks. Public health was a small part of that, but we've not done enough. In fact, the public health system has dramatically eroded since that time. This is a visionary thought that the senator and representative have put together for us to once and for all build a 21st century public health system to deal with the problems that we have today. The problems we have today are wildfires out on the West Coast and having to address the human health impact of that. The tragedy that we saw both in Houston, Florida, and the southern states from the hurricanes that we just experienced. Think about this, a whole city that simply just couldn't take their hand and turn on their tap for tap water because they lost the water. That's a public health problem. Requires a thoughtful solution. Think about, as the senator said, the fact that we are aggressively having to spray again for mosquitoes. We're going to have to get rid of old tires and all kinds of places that we're worried about because of vector-borne diseases. Think about the people that have died because of heat-related events, and we're going to see more of those over the next several years. And we need to have a modern, well-staffed, well-funded public health system to do that. And they do that on the strategic plan. And so what this piece of legislation, of course, does is help craft that in a very thoughtful way by directing the Department of Health and Human Services to take a lead and make that happen. You know, we're all concerned about whether or not this will happen. I think this piece of legislation will ensure that it does and ensure that it's done in a thoughtful way. So thinking of the things that I've done through my life as both an emergency physician and a public health practitioner, Senator, I want to thank you again for your leadership here. I just think it's extraordinary, and this is what we need. And I often get asked by folks, now what do we need to do? We need to make a plan, execute that plan, and put the resources behind it. Senator, thank you.
Thank you. I appreciate it. Thank you, George. I appreciate it. You know, Scott Pruitt says that it's not the time or the place to talk about climate change. And I agree with Scott Pruitt. It's long past the time to talk about climate change and its impact on public health. Now is the time for action. That's why we're gathered here today, so that we can begin to put in place the kinds of solutions that help families to deal with the consequences of climate change. And next we're going to hear from Liz Martin Pereira, the Climate Policy Director of the Sierra Club. Welcome.
Thank you. Thanks. Thanks, everyone. Thanks for joining us here this morning. I want to thank Senator Markey and Congressman Cartwright for this fantastic piece of legislation. And I want to thank my fellow speakers, Dr. Benjamin, Dr. Adhoot. I'm Liz Pereira. I'm Climate Policy Director of Sierra Club. And in my role, I have actually been putting my public health degree into practice. And I've been a longtime member of American Public Health Association. I work with families across the country who are feeling the impacts every day. Our members of the Sierra Club, they're feeling the impacts every day of these wildfires out west. They're feeling the impacts of Hurricane Harvey and Hurricane Irma. And you know, they are looking to the government as their best defense from these threats, and sometimes their only safety net. Unfortunately, the Trump administration has put all of that at risk by trying to throw out public health laws on carbon pollution, pulling us out of the Paris Climate Agreement, and proposing to dramatically cut the budgets of critical preparedness and emergency response agencies that this country desperately needs, now more than ever. In fact, the Trump administration is not just rolling back safeguards from climate change and carbon pollution. They deny climate change is happening. I would say Trump's climate denial is a slap in the face to all of the victims of Hurricane Harvey, Irma, Sandy, and Katrina, who may have lost their lives, their homes, and their communities from these massive storms. We all know, and the science confirms, that the climate crisis made these storms worse, and we know that these people were the victims. Our hearts are with all of those in Texas and across the Gulf Coast, the Caribbean, Florida, Georgia, and the Carolinas who have had their lives affected by Hurricanes Harvey and Irma. The total extent of the impact is still unknown, but from what we know, it's devastating. Harvey and Irma are especially devastating because they're hitting the most vulnerable people the hardest. They're devastating low-income communities, farm worker communities, and communities of color, and making the toxic circumstances that these neighborhoods face every day much more dangerous. Thankfully, the heroism and sacrifice of public health professionals, first responders, and volunteers who are risking their lives and working tirelessly to save others is inspiring all of us to do better. And that is why Sierra Club is applauding Senator Markey and Congressman Cartwright for introducing the Climate Change Health and Promotion Act of 2017. This bill ensures that the federal government, under any administration, will do its job to put a system in place to protect the health of our families and our communities by making sure we identify, monitor, and prepare for and respond to the adverse impacts of climate change. As we know, climate change is making these storms worse. It's like putting our weather on steroids. It's turning a Category 3 hurricane into a Category 5. Climate change definitely is going to affect sea level rise, which is going to exacerbate impacts of floods, hurricanes, and storm surges. And we all have heard about the impacts from vector-borne diseases. We know it degrades air and water quality, and it exacerbates allergies and life-threatening asthma attacks. We have to prepare our families for this new reality. We cannot bury our heads in the sand, especially while the seas are rising. We must prepare our entire public health infrastructure for the new reality of climate change. And as Dr. Benjamin has said, this public health infrastructure is woefully underfunded and needs better investment. We must work at the local level because community leadership is so critical when it comes to preparing for and responding to these climate impacts. And at the same time, we know, especially Senator Markey, who's been a leader on not only this, but many pieces of legislation to rapidly reverse course on carbon pollution in this country. We must produce energy transitioning from fossil fuels to produce clean, renewable energy and create jobs as rapidly as possible to stem the tide of the very worst impacts to come. We know we are actually only feeling the effects of carbon pollution we pumped into the atmosphere 50 years ago right now, and we haven't even begun to feel the effects of the 450 parts per million carbon dioxide concentration in our atmosphere. The time is now to move forward with common sense measures like this to protect public health in the face of the coming age of climate disasters, and at the same time do everything we can to cut carbon pollution, the root cause of climate change. Thank you.
Thank you. And next we're going to hear from Gretchen Dahlkemper, who is the Director of Special Projects from the Moms Clean Air Force.
Good morning. As Senator Markey said, my name is Gretchen Dahlkemper, and on behalf of Moms Clean Air Force's community of more than 1 million parents across the country, I want to thank Senator Markey and Representative Cartwright for standing up today to say enough is enough. Congress must act to protect the safety and the health of our families. Today, our human activity, is directly impacting the health of our children. We are bearing witness to the devastating impacts of our altering atmosphere in ways that we have never seen before. Rising temperatures, extreme weather, disruption in the food supply, increases in smog and particle pollution. These symptoms of our climate and chaos contribute to asthma attacks, heart disease, stroke, lung cancer, premature death, emergency room visits, hospital admissions, low birth weight, premature birth, diabetes, and pneumonia. Last week, my 2 oldest kids went back to school, and for my 6-year-old, it was the 5th year in a row that along with her brand new notebooks, I also dropped off an asthma inhaler with the school nurse. Her asthma inhaler sits next to hundreds just waiting to be used, ready to be used if needed. And unless Congress takes meaningful action on climate change, my child and our children will need those asthma inhalers more now than ever. As parents, we reject doing nothing as a viable response to the overwhelming proof of climate change, something we are experiencing this very day with our very eyes. As mothers, we are problem solvers by nature. We solve problems from the moment we wake up until the moment we go to bed. Today, as mothers, we are simply asking Congress to do the same thing, to do their job and solve this problem. We, as American citizens, contributed to our climate crisis, and we know how to stop the most disastrous impacts. There is a vacuum of leadership on this issue, and today, mothers from across the country ask our elected leaders from every state, from both houses, to join Senator Markey and Congressman Cartwright to work across the aisle on a broad policy that will reduce climate pollution and invest in clean, renewable energy while improving the health of our families and the safety of our communities. Congress must work together to make possible what is essential for our children's lives, a healthy and safe place to learn, play, and grow. Thank you very much, Senator.
Thank you so much. Yeah. At the beginning of the 20th century, there was a Republican president who said, "Speak softly and carry a big stick." In the 21st century, we have a Republican president who says to the children of America, "Breathe softly and carry a big inhaler," because there is no problem that is being created for the climate, for the pollution that's being sent up into the atmosphere in our country. And that's why we're here. We're here because of Donald Trump, because he is a climate denier. Donald Trump gets his climate science from Trump University, and it's as bogus as a degree from Trump University. So we are here just to make sure that we will be able to have a debate on this issue at the same time that we're seeing the consequences of not dealing with this issue. So next we're going to hear from Dr. Samantha Adut, who is from the American Academy of Pediatrics Council on Environmental Health. Welcome.
Thank you so much.
Thank you.
I want to thank you, Senator Markey, for your consistent leadership on this critical issue. On Tuesday in my office, I saw an 18-month-old boy I'd never seen before. He was brought in by his parents, and he was a new patient. He was visiting because his family had been evacuated from Florida, from the Fort Myers area. He was one of 7 million people evacuated from Florida. And children's social, physical, and cognitive development depends on stable community systems. Children rely on their schools, on their homes, on the safety of their communities, on their doctor's offices, on their hospitals. And extreme weather events, through disruption of this basic social fabric, puts our children at risk. And as these events increase, doctors like myself are going to see more of children suffering from displacement, from disruption of their education, from loss of parents and caregivers, from injury, and from parental loss of employment and insecurity. Legislation like the proposed legislation is critical for preparing physicians like myself, as well as hospital systems and health departments, for being prepared to address the needs of these families and children. There are many uncertainties and many gaps of knowledge in how we can be, as physicians, can be best prepared to help our patients and protect them. We need coordination between the CDC, the National Institute of Health, between our policy leaders to create policies and strategies that will fill the knowledge gap. For example, there are very complex interactions between the climate and vector-borne diseases. We've never had to worry before about how changes in humidity, how changes in temperature, in rainfall patterns, in extreme events, how these influence diseases like Zika virus and other tick-borne diseases like Lyme disease. We need to understand these relationships so we can better protect our patients across the country. And children, who are the most vulnerable group to Lyme disease, who have the most at stake from disruption in their communities and destruction of their homes and families, are the most vulnerable group to the health effects of climate change. More than 88% of the global burden of disease due to climate change occurs in my patients, occurs in children. So I'm so grateful to see the leadership that's coming from Senator Markey on this issue, and we look forward to continuing to support your efforts.
Great. Thank you. I appreciate it. And again, we keep coming back to President Trump and his all-star team of climate deniers who he has named to run the EPA, the Department of Energy, and an agency after agency across the federal government. It is completely and totally a crime against the public health of our country and the planet that our president continues into his denial on these issues. Mar-a-Lago, according to experts, by the year 2030 could have a threat of flooding for 200 days a year if the trend continues in Florida. Mar-a-Lago will turn into Mar-a-Lagoon for President Trump. Now, he'll be able to protect himself by building protections around Mar-a-Lago. But these families whose faces we see every night on television, they will have no such protection unless we begin to put that protection into place. And I don't know, maybe Juanita, you would like to come up and just say a few words. Juanita is Director of the Climate and Clean Air Program for the NRDC. Please come over, Juanita.
Thanks very much. Thanks, Senator Markey, and I'm really delighted we're having this conversation today. As you've already heard, public health, when it comes to climate change, is an emergency, and we are woefully unprepared for it. In July, NRDC put out a map with some air quality data from states and counties across the country. And while we were doing that analysis, we found that fewer than 1/3 of public health agencies were prepared for planning for dirtier air as the climate changes. We can do better than that, and this legislation is a critical piece of that. Our health professionals are on the front lines of climate change. They're dealing with the local health impacts every single day, and this bill is incredibly important for helping make sure that they have the resources they need, the training they need, and the knowledge that's inherent in every federal agency of this country. So thank you for being here, for showing your interest in this, and thank you so much for your leadership.
Thank you, Juanita. So, are there any questions from the press? Yes, sir.
Yes, sir. Brian Dash, Virginia. Right now there's a push underway, bicameral push to advance the tax.
By whom, I'm sorry?
Bicameral.
Okay. Yeah, by camera, I see, yeah.
To advance the carbon capture and sequestration tax credit. Senator Whitehouse is an ally of yours in pushing for environmental policies toward that. I'm wondering where you line up on that.
On carbon capture and sequestration?
And do you think it is useful in addressing climate change?
Well, in 2009, when Henry Waxman and I were putting together the Waxman-Markey bill that actually passed the House of Representatives to reduce greenhouse gases by 80% by the year 2050, we actually included $200 billion for carbon capture and sequestration over that period of time up to 2050. Peabody Coal and Alpha Coal and other coal companies all turned it down. They said that they did not support that legislation. So now many of these coal companies are bankrupt, or their stocks have turned into almost penny stocks. So yes, of course I supported that concept in the context of a comprehensive approach, whereby we would be ensuring that we were increasing the fuel economy standards of our vehicles, and that we were engaging in massive increases in energy efficiency for the buildings and the appliances which we use, and a massive deployment of renewable electricity technologies across our country so that we can meet the goal. So yes, of course, I support it, but it's still in the context of an increase in funding, for example, for offshore wind, or for fuel cell technology, for small for small wind projects across our nation. So it's in that context that I would continue to support carbon capture, but knowing that there'll never again be $200 billion available. The coal industry was given the best offer they would ever be given, and they turned it down cold in 2009. Yes?
Hi, Ariana Skydal with E&P News. There's some movement in the House with the Climate Solutions Caucus to address, for Republicans to address climate change, and they're sort of looking at free market measures. Do you think that to sort of addressing this problem, it's going to have to be a kind of market-driven approach, or do you see regulation as being necessary, and what's the balance?
Well, the problem is, for too many years, the largest companies, the oil companies, the gas companies, the utilities, they all use their control of the government levers to block the unleashing of real competition. So yes, I support free market principles. I support the introduction of Darwinian, paranoia-inducing competition to the traditional fuels in our country. But of course, right now, the auto industry is saying, well, they don't think they can meet the fuel economy standards of 2025, 54.5 miles per gallon. The utilities and fossil fuel industry are now fighting any further extension of the wind or solar tax break while still wanting to keep their own tax breaks for oil and natural gas and coal. So that's the hypocrisy that has fueled the problem which we are now confronted with in 2017. The industries that, with crocodile tears, say that they really believe in the free market actually have used their power economically to ensure the political process does not make it possible to respond. So in 2016, we saw the deployment of 14,000 megawatts of solar and 9,000 megawatts of wind in our country. 10 years ago, it was almost nothing. So those policies were because of Barack Obama and the Democratic control of the House and Senate, with Republicans voting no for the most part. So we're going to need these companies to kind of square up here. You know, if they believe in the free market, then it's the introduction of all the competing technologies as well, and then we're off and running because we'll win. Wind and solar is going to bury coal historically. They're down to 50,000 employees, the coal industry. There are 500,000 people now working in wind and solar by the year 2020 in our country. And who are those people? They're electricians, they're roofers, they're blue-collar jobs all across the country. The only blue-collar jobs in our country are not coal miners. They're the people installing wind on roofs of buildings, solar on roofs of homes, offshore, blue-collar jobs. It's the renewable energy revolution is the single greatest blue-collar job creation engine in generations in our country, but you'll never hear the private sector outside of those industries standing up and extolling that. But over time, we're going to see that that there's an old saying that hypocrisy is the tribute that vice pays to virtue. So we hear them saying that they support, these alternative technologies, but they've worked relentlessly to block their introduction. And now we're beginning to see these apertures, and they're going to the Trump administration to get the administrative and tax protections against the revolution continue at the pace which it has in the past. Question from anyone? Thank you all so much for being here. Thank you. So the great Congressman Matt Cartwright from the state of Pennsylvania is here. His constitutional duties having been discharged on the floor of the House of Representatives.
Well, up to now, we have more votes later. We have a quick break right now. But I would like to thank Senator Markey for his strong words and his longstanding leadership on climate change. I can't think of anybody else on Capitol Hill with the knowledge, the passion, the dedication that you have shown to this existential threat. We are fortunate to have you fighting on our side of this battle. I'd also like to thank the other co-leads in the House, Congresswoman Matsui, Congressman Carbajal, and Congressman Schneider, for working so diligently on this important bill with us. The recent hurricanes in our country obviously illustrate the often tragic acute results of climate change. They are displayed across our television screens daily. They can't be ignored. But climate change does not just appear in the form of disastrous storms. It impacts our lives daily, from the air we breathe to the water we drink, to the food we eat. Today, we are here to focus on the too often underappreciated and underreported effects climate change has on our health. While we're only seeing and understanding the tip of the iceberg for climate health impacts, here are just a few examples of what we know of. Water contamination from floods exposing us to toxic chemicals, wildfires burning through the West, and massive amounts of fine particulate pollution in the air causing asthma, bronchitis, and chest pain. New patterns of diseases such as Lyme disease, which has increased dramatically over the past 10 years, and diseases transmitted by mosquitoes like West Nile and Zika. They're on the rise, and they're just a few examples of what we're talking about. Who will be the most affected? People living in poverty, people with disabilities, the elderly, pregnant women, young children. We need to act to protect everybody, but especially our most vulnerable. It's clear we're not ready. Most state and local health officials do not believe they currently have the expertise or the capacity to address the effects of climate change or to assess the potential impacts specific to their states and communities. And without legislation like this bill, our current administration will not take the threat seriously. The Climate Change, Health Protection and Promotion Act will help improve our nation's public health response to climate change. It will create both a plan and a program to address the threat. Is a bill that recognizes the need to conduct more research on how climate change will impact our health. We need to place public health at the center of all of our decisions. We need to think in terms of planetary health, of interconnected systems, energy, natural resources, agriculture, urban development, and public health. Our bill will help improve our public health by bringing together an interdisciplinary team to come up with a plan to respond to the impacts of climate change on our health. Our bill will support the healthcare professionals who work tirelessly to take care of us and who will be on the front lines of the fight against climate change. To protect our people, we have to recognize the reality of climate change and the importance of protecting our natural world. Together, we can mitigate the worst public health effects of climate change. We can protect our children, future generations. We can save billions in healthcare costs. We can keep our communities safe and healthy. The time has come to acknowledge the challenge ahead of us, to roll up our sleeves and get to work. Thank you, Senator. This is Brad Schneider, who's been working right alongside us. Go take it away, Brad.
Come on in, Brad. Say a few words.
Thank you.
Yeah. Thank you for coming over, Brad. Thank you.
So I'll be brief. I just want to, in particular, thank Senator Markey for your leadership on this issue, not just in this case, but for many, many years. And you have been a role model and an inspiration to all of us. I want to thank my colleagues, in particular Matt Cartwright, who have put this bill forward. Let me take a moment also to thank Moms Clean Air Force for the work you're doing at home, throughout the country, making sure voices are heard. This is about the future. This is about our children, and you guys get it. So thank you very much. Understanding the effects of climate change having on our health, having on our cities. The example of the storms of the past month show how devastating the acute impact can be. But as Matt Cartwright said, the impact is happening every single day, and it's affecting our health. This bill requires the Secretary of Health and Human Services to prepare a federal strategic action plan and to implement a national program to ensure public health systems throughout the country are prepared for and can respond to the impacts of climate change on public health. We need to prepare the health system for the effects of climate change by enabling enhanced disease surveillance, research, communications, education, and training programs. I'd like to thank Senator Markey and Reps Cartwright, Matsui, and Carbajal for their leadership on this bill, and I'm grateful to be a part of it. Thank you very much.
Thank you. Any questions for, yes, please.
You addressed, the president called him a climate change denier. With Republicans at control, can you just address, how hopeful you are or how likely it is that this piece of legislation will be approved?
I think we're going to see a public health catastrophe unfold as each day and week goes by here in 2017. And I think it's going to be clear to people that it's a preview of coming attractions if we do not put in place a comprehensive system to respond to the impact of climate change. So I'm optimistic that all issues go through three phases: political education, political activation, political implementation. So we're in an intense political education phase right now. I think many members, Republicans especially, are seeing what the impacts are of not having a realistic assessment of what the damage can be to public health. And I'm optimistic that more of them who actually do believe in climate science but have been intimidated by the Koch brothers or because of the ideological control that some of the more conservative elements of America have over their party are going to begin to break out because they are going to see the human impact. So I'm actually becoming increasingly optimistic that we can put something in place.
Senator Markey, I want to say I share your optimism. I think I've been in the Congress now for almost 5 years, and since I've been here, we've been seeing some green shoots. An example of that is the Climate Solutions Caucus in the House. We now have bipartisan members. We have 48 members in total, 24 of whom are Republicans. That wasn't something we were seeing 5 years ago. But maybe more importantly, we have an important ally in this, and it's corporate America. Corporate America increasingly are taking safe climate pledges, taking Fortune 500 companies are signing pledges that we're still in the Paris Climate Accords. Eventually, in our great nation, where we're all good capitalists, business people are listened to, and they are listened to by Republicans. So I do have every shred of optimism that Senator Markey has, because I'm seeing the change occur. People are starting to come on board. Right?
I'll echo that. I think what we're seeing around the country, people seeing that we are facing increasing challenges, increasing costs of storms. There's an element of common sense that's not new. Whether it's an ounce of prevention is worth a pound of cure, or a stitch in time saves 9. There are people who are recognizing that this is the time to act. We are near, at, or God forbid, across the tipping point, and the time to act has actually passed. So hopefully it will come through.
Thank you all so much.
Thank you. Good to see you, Ed. You're good.
So